Good morning, everyone. Today, I welcome you all in PIDE's Breast Cancer Awareness Session. October is the Breast Cancer Awareness Month, and the color associated with this initiative is pink. World stats shows that 1 out of 8 women can be diagnosed with breast cancer. As we know that most of the victims are women, but there are 2% chances of men to get the breast cancer. The need of awareness is because that early diagnosis can help save life and it can halt the spread of cancer through beyond breast. Today we have Professor Dr. Aisha Isani Majid. She holds an MBBS, MCPS, FRCR UK, MPH, MHPE, and PhD in public health. She is head of radiology and Federal Breast Cancer Screening Center, Pakistan Institute of Medical Sciences, PIMS. Dr. Aisha has successfully executed the Federal Breast Cancer Screening Center and provides free state-of-the-art facilities of mammograph, ultrasound, and biopsies. Dr. Aisha has created an initiative by creating Breast Radiology Society of Pakistan and an academic journal of breast disease and research, which is an international research platform. Dr. Aisha is actively involved in spreading awareness regarding breast cancer, and today she's gracing PIDE. I welcome you, Dr. Aisha, and would ask you to please share your breast cancer awareness campaign here. Thank you.
Thank you, all of you, for being here. We'll just start the presentation bit, but I wanted to be interactive, and what I really like and the thing of going to all of you coming here is that I would wish for you to all come here to me, not only for screening and not only for the month of October, but throughout the year. And maybe there are different aspects of the work we are doing there. It's usually advocacy only, generally what people give. But what I do is that I believe in services. Okay, you raise awareness, but then people shouldn't be roaming around and saying, where can we get facilities? You should always also have a door open for them. And that was what started. It's a decade now. And we did our event, was a decade of achievement of the Federal Breast Cancer Screening Center. Before we start here, I'll just like to tell you that I remember 10 years ago, it was in October 2013, there was this project, a devolution happened. This project of the breast cancer centers, screening centers was got changed. Thank you. And we were, it was handed over by the ministry to PIMS. Oh, this is a sick project. It's a sick project. It's never going to happen. Lahore, Quetta, Peshawar, Karachi, they all had these centers, but it all fizzled out. Islamabad was the only one which was left. And when it came there, I'd just done my MPH, and you're full of enthusiasm. You become a student again, and can I just have a go at it and try it? And nobody believed in it. They said, okay, we'll just give you. There was hardly fiscal year, like 8 months left. In the fiscal year is like 30th June. And they said, okay, if you can perform something till then, we'll let it continue. Otherwise, we'll reappropriate it to some other thing. Women's health, I'm sorry, but has never been the top priority. They do a lot of advocacy, but believe me, in the actual living situation, it is very difficult to convince people. So we did that. And then I thought that, oh, what can I do? I can't make a building in the 6-8 months. How will I just do it? There's nothing. And then we interacted with the community. Why not spread awareness? So for the 6-8 months, and then the year later, while things were in the pipeline and streamlined, we did a lot of awareness. And I'll just walk you through my presentation. And that made all the difference. So before the center came up, before the facility was there, people were ready, women were ready to just come in for their screening. And that is well women. That's also what I'd like to reassert. और मैं कहना चाहूंगी कि well women है, बहुत फर्क है. We are माशाल्लाह all well here in this room. तो हमें screening करानी चाहिए. जो बीमार है वो तो आके will have their things done. But that's also a big message I'd like to give to all of you. So let's see the 1 in every 8th woman. So I've just put in a slide so you see that when you detect this cancer early, आपका 98% survival rate है. So in advanced, it goes down 50, 60, even less, like 27. So why let it be there? Why not just, if it's going to happen, it's going to happen. Okay. There are certain measures, but it is not like you take a medicine or you adopt a certain lifestyle, then it is not going to happen. You reduce risk factors, but ye bhi clarity mein laun, but if it is there and that disease is going to happen, it's going to be there. You just have to catch it early. Another set of statistics, this is the latest from Pakistan, again, that in women, the breast cancer is the most commonest. Let's see, where do we stand today? So we've put in the new statistics from the 2017 census. And as you see that nearly half the population is women. That's what I want to show you in this, in all of these figures, and province-wise as well. And you see Islamabad everywhere. So nearly 50% of your population is women. And do you know how many, could I just ask that how many of these would need screening by mammography? Any idea what age, which age group? So it's 40 years generally. We follow the American College of Radiology because they've got a lot of high risk population there. Pakistan, maybe we are all high risk. So they have the Hispanic, the Afro-American populations. They advocate for 40 years. Even the new advocacy has started at 35 years there because they're seeing so much of breast cancer. Right? And here you just see, again, the same sort of thing. I just wanted to put in data. It's for sharing, so you're all updated. Okay, so what did we do initially? So we I had this 8 months, what to do? So split Islamabad, it's rural and urban Islamabad. We figured out a population thing in that, and we saw that, again, half of the population is there. Or kitna hai rural Islamabad is just what? Just here, I think 5 minutes from all of you, 10, 15 minutes from us. It's not that big a district or something which we can't reach. So that is what we targeted. And I always had a soft corner for the rural bits because I said, I've always noticed if you spread awareness in them, those women are more ready to fight for their right and come over. The more educated we are, I think the more we think a lot more and do less action. But those women, if you just once convince them, they just come over. And that is what I'm seeing as well. Okay, this is again for you. So you see, that's how we scientifically went about it. For the Islamabad sectors, we identified like that. And then we saw for the other bits there in the rural, the 2 talukas again there and all that. So this is what we did from 2013. Aap dekh rahe hain, so it's the first ever public sector facility. I'm very proud to say, and I keep on advocating this, that there is no public sector facility for this. You've got private setups, but that's for diagnostic workup. So we've got 2 state-of-art mammography machines. I'd like to invite you all to come over. We've got contrast enhanced mammography. We've got the ultrasound, the elastography. We do ultrasound guided stereotactic biopsies. We have workstations, and all of this was inaugurated, the building with this equipment, in 2015. And the main thing is it's a free state-of-art facilities for women. Or bilkul, you just have to walk in. There's no big hassle. You take an appointment, you're ringing up, nobody's picking a phone up. It's a walk-in, and there's a timeline. We work 8 to 2, 6 days a week. Hamara Saturday be working hai. So it's very convenient for people who are working, women, even men come to us. So you all please do come in, and it's totally free. You just have to walk in and see. And we like, because we also like to know that we've done this person lives there, ethnicity, etc., etc. That's a requirement, and that's about it. And you just come in and get it all done. This is the building there. It is behind, if anybody of you must have visited PIMS, so it's behind the Maternal and Child Health Center and adjacent to the Burn Center, located within the thing. So what did we do? We do population-based screening. So community-based health education component was what happened initially. Phir humne free screening mammography. 40 years is a general we keep, except for high risk. Genetic screening we've done, and development of a CADEX-based pipeline using AI. तो community में हमने कैसे किया? So we did small group discussions. For example, like half of this thing. Then we did focus groups. We did lady health workers. They've been part of my, reach out for about 10 years now. Lectures, seminars like we did, walk seminars, communication skill workshops, and then reflective portfolios for facilitators. There was a number of people who are now master trainers. They moved ahead in their careers, लेकिन उनको हमने जो है ना reflective portfolio से they improved themselves during this time. So this is, if you people would like to, have something of like this sort from your institute, I'd just like to share how we did it. So there was a community of interest. जैसे अभी है, I always say that when I go to a university, and then, when you keep on going, did a repeat, then they became a goal oriented. Yes, we are going to work for breast cancer. We are going to go to the household. We are going to help people, tell them that there's a place you can come to. And then also things like we made, some of the LHWs were very proactive. And then they said we took mannequins, made them do self-examination, that they can do it in actual life. And role models. So one was a patient, one was the mentor, tutoring them. And we did so many things. I think the most beautiful time, I believe, of this work was the first 2 years. You're full of enthusiasm. You go, you teach them. You know how it is. I think it was the best memory ever. Here, community of practice. And now if you come here, we've got culturally in sync with the culture of our country. Hamara women based hai, because 99% is women. So from the doctors, from the receptionists, from the technologists, it's all women. We've got men seating area. We've kept it a bit on the side so that women are comfortable. So now what do I have in a community of practice? So I have women in pairs coming. I think the most fruitful thing was that. Do behne, maa beti, a friend, bringing another friend. So, this is what I inculcated. Pehle to when it started off, even if one woman came, or even if two came, and then we said, oh, it's a highlight. Initially, really, it was like this. And now it's like even 5 to 2 o'clock, they're coming in. No, we're not going to go back, do our workup. And that's how it's become. It's become a community of practice in Islamabad now, thank God. So all of these, we did the BHUs, RHCs, BHUs 13 hai hamare idhar, or 3 RHCs hai, or around 360 LHWs. And in that 2 years, 20,000 women we reached. So they've got health houses also. They've got this. They have a great community following. Lady health workers, kyunki they go to their houses. So they all, when they say give a call out, I'm telling you, all the women of that village, inke takriban one lady health worker has 1,000 women population registered. So when jab wo call deti hai, so then they all come. So it was an excellent tool which we had, and they really helped me and delivered. ये वैसे है for you people कि हमने कैसे किया, 12 का हुआ है, भिम्बर, चिराग, तो आप देख रहे हैं कि इन सब में we worked and all that. Then this thing in the colleges, schools, as all of you know, I also am a big advocate of public sector. I myself have studied in a public sector school and a college. So मैं बहुत advocate हूँ और मैं कहती हूँ कि why not start from there? Yeah, I big believer, and universities, of course. Then we did a cap. So I was just sitting with someone and I said, I'm going to get hold of all of you for a knowledge attitude practice thing. So we did 1,000 women assessment, right? And we did it at the MCH center there at FIN. So the maternal and child OPD, we did it there. And I wanted to know that, let's see कि कितना इनको पता है breast cancer का, mammography का और सब. So you get the stats here, 34 plus minus 12 years hai. So usually family history isn't that big a predominant thing. इधर इतना नहीं है जितना लोग समझते हैं कि बहुत ज़्यादा वो है. Among women with positive familial history, 35% had either a mother or maternal relative affected by disease. And most of the female, we saw, of course, they were coming to the MCH, so most were married. So education status, mainly they were metric, then followed by graduates. Then regarding breast cancer awareness, that despite 75%, so 750 out of the 1,000 knowing the name of the disease, only 32% had proper awareness regarding the process, purpose of mammography and breast cancer prevention. तो देखें कि उनको ये तो अब पता है कि जी breast cancer है, there's a disease and all that, और वो बात भी बहुत टीवी वगैरह पे चलती है, लेकिन आगे how to go ahead, आपने स्क्रीनिंग करानी है, क्या कराना है, अर्ली डिटेक्शन, उसका देखें ना कि even now we are not really getting down to educating the people. Awareness is one thing, but we have to educate them, na? So they know that they have to go somewhere and get help. Again, majority of the patients did not know the right age of mammography. Media was the most common source of knowledge regarding breast cancer. Baki, the pamphlets, books, newspapers, and then the hospital. So when they come to hospital, they're sitting there waiting in time, and then they get to know. So our test showed association between the education, positive family history, and breast cancer awareness, while no relationship was found between the marital status and the breast cancer awareness. Ladies, when they were asked about performing mammography, you see, so this is 242 ladies, and 24% only had mammography. And the reason for not having mammography, majority answered their physician didn't prescribe, followed by considering the age not fit for mammography, shyness, and financial issues. Lekin dekhiye, for us also it was an opener. And we saw that, oh my God, hum hi nahi karte. We don't tell them. Even if they come to medical OPD, they might come for their diabetes, they might come for their other checkups. Why can't you just, we as doctors actually in a clinical setup should just make it, have you had your screening mammography after puppy? Everybody should do that. At least in a gynae setup, so they should do it. Even there, it is not advocated that you're well, you should go for screening, and it's just next to it. So that was an eye-opener for us as well. So then we saw that only positive family history was one of the major factors regarding mammography. So जब आपके family में किसी को होता है, then it's very close to heart, एकदम से, because they're undergoing the battery of tests. आप भी जो है वो बस फौरन अपनी scare से those people, then those women come and they have that. And imagine that they're sitting there in the MCH, and about the PIMS free mammography screening services, only 48% had knowledge, and out of them 39% were informed by the physician at PIMS, and unfortunately only 43 participants, and these had no clue. आप सोच सकते हैं कि in our setup you're just next door, you're getting a checkup, you're sitting for hours, and in a maternal that setup you're coming at least 2 or 3 times in a 9 months period, but you don't even know about these things. So आप देख रहे हैं हमें तो बहुत ज़्यादा effort करने की, because it's a, you people are also as researchers and as a premier institute इधर, so that's why I was wanting to share this. कि आप ये देखें कि I don't know where we are far behind, need a lot of work. So this is just the article, forget that. So this was like initially years ago. So we were there, women. देखा आपने कि इनका response, इनको तो कोई हिचकिचाहट और वो नहीं थी, देख तो आपके पास आके पूछती और करती, and they fight for their right and all that. Other places, students, there, this was the media person and all that. And this is, all the rural Islamabad. Very nice it was. We had, this is in the initial thing in 2014, we started, and the walks and all that. This is my vice chancellor of that time. And this was later. This is like 3 years ago or something. So what have we done to date? Right? So we have educated 50,000 women. We've done a mammography 10,000 plus up to ho gaya in October. Ultrasounds 20,000 plus. FNACs is the fine needle test. That's mostly for fibroadenoma, cysts, etc. done in younger girls. 820, and biopsies 980, and total cancers were 1,800, which were done. So we've given you the annual screening mammography thing. Just to show you, we've got two. So this is the state of art mammography. The moment FDA had approved this, In 2014, we got this machine. So this is a 3D tomography machine. It is the best. It was the first in Pakistan, and then Shifa got it, and now Aga Khan and Shaukat Khan both have it as well. So a mammogram, just for awareness. These are the Japanese. I'm trying to get the diplomats also. I'll tell you that where is a gap where I need to fill in. Right? So they're very interested always in seeing the actual work on ground. This little girl and another counterpart of hers doing it for 10 years. So genetic screening हमने वो भी की 300 women किए for BRCA1, BRCA2. आपको पता है कि वो it's very easy. इधर भी अभी it is still not being done in Pakistan. So if you go to a lab and if you have a family history, mother had it, Khala or somebody, and you want to know your own status, they'll send your thing. Actually, they'll say, oh, just give 80,000, 1 lakh rupees, and it actually goes to Germany if they've got it. It is still not being done. Despite us having such premier genetic genetic departments and I don't know biology departments and whatnot. So abhi maine ye kiya hai 300 patients ka collaboration with Quaid-e-Azam University. We won a project. So we saw that out of these 36 had BRCA1 and BRCA2 in 27. So this facility should be available here. In the general public, at the site of screening. When you'll come, you'll see we have space there, but nobody just starts up. You talk, so now this is proof that we need it. देखें कि कितना ज़्यादा आपको इधर आ रहा है. And these were all those patients who had breast cancer. So because we had limited resources और हमारे project में हमने prove करना था कि है mutation इधर. और कुछ ऐसी novel है जो कि it's not even in the other parts of मतलब in the West and stuff, which is novel to Pakistan. It's under publication, and I'll share that with all of you. So why can't we do that? 80,000, 1 lakh ka, I am sure, okay, we won't be, if one cannot even do it free, it can be subsidized to 1/10 of the cost. And why not something like that? But मैं ये कह रही थी ना कि research को practically भी तो आपने translate करना है ना. Now I've done this. Now my next step, I've proven it that it need है. So the next step should be कि मैं एक ऐसी lab का वो करूं ताकि जो लोग हैं अपने बिल्कुल उनकी बेटियां हैं बहनें हैं, they can all have this at a subsidized rate. So I'd like your help in that as well. So this was an initial one. AIPB, we won a project in 2019 in the Pakistan Science Foundation. So we've got immense data. Data is the new gold. And so my aim is to utilize this abundant indigenous data. We tried here a lot, even GK, ComSats, everywhere, NAST also, and all that. But even though I have the GPU and everything, but then I had to collaborate. At the end, we collaborated now with Pexira. This is a company. It's a Boston-based US company, because here, again, the same problem that I can't have a clinical application for it. They'll come, fiddle around, make a small thing software. But at the end, I'm not confident enough to use it as additional reporting. Remember, I'm not saying. हमेशा याद रखें, everywhere in the world, the perfect reporting of mammography is double reporting. आप अगर UK, I'm a fellow from the Royal College, so the first thing when I do my appraisal every year is they ask, are you doing double reporting or not? और double reporting का मतलब है 2 fellows, not a student and a teacher, and not like that. So, ये था कि at least we have one additional thing, and if I go to the community and all that and have a mammography machine, my dream is that to have it a van-based thing to go around the BHUs, एक को उधर लगा दें, तो आपके पास एक टूल हो, उसी वक्त रेड फ्लैग हो, वो पेशेंट्स को आप फौरन जो है ना टाइम डिले ना करें. So we are in collaboration. I'm the AI bit, I'm teaching it, and it's learning through our reporting. It is interesting. So we did a breast radiological society, इसीलिए था. In 2020, and also a journal for breast diseases and research, वो HEC में अभी है for recognition. और BRSP का ये था कि हमें international और national collaboration एक platform भी चाहिए होता है आपको for funding for all these women. So that's, as I said. So all the people, except for the grants we won here, the collaboration. So who helped me was through the J. Simon Kirby Fund. मैं हमेशा उनका जिक्र अभी करती हूँ, through Monopoly Needles, and that was very necessary because the only cost incurred, जो मैंने आपको कहा था, is the Monopoly Needles. They are 10,000 rupees. So हम procedure free करेंगे, आपकी पैथोलॉजी भी सब्सिडाइज फ्री भी हो जाएगी या 250 रुपए पे. बट ये आप लोग हैं इकोनॉमिक्स के प्रीमियर इंस्टीट्यूट, इसलिए भी मैं ये आपसे ये शेयर करना चाह रही हूँ. बट मोनोपली नीडल एक ऐसी चीज आइडेंटिफाइड थी कि अगर वो लोग गरीब है, देखिए वो आते हैं, नहीं कर सकते. अगर हमें भी कहीं जाना हो और अचानक की जरूरत पड़े, हम भी शायद कहेंगे अच्छा हम कल आएंगे, वील अरेंज. वो तो व्हेन दे गो अवे दे नेवर कम बैक. और जो यंगर पेशेंट्स है स्पेशली, चलो जो जरा बड़ी हैं, जिनके हस्बैंड सेटल्ड हैं, जो कि बिल्कुल यंगर है, वो तो they don't come back and you lose them. And that was really weighing on my mind कि भाई मैं doing so much in there. But they helped me from the American embassy here. It was a small fund, a $4,000 fund, but 120 needles, so 120 people at least I can help. So that was very heartening. So we are also in the process of setting up a registry. वो भी बहुत जरूरी है. Can you imagine कि अभी तो वैसे कैंसर रजिस्ट्री भी नहीं है पाकिस्तान में, लेकिन मैंने एटलीस्ट ब्रेस्ट कैंसर रजिस्ट्री जो है हम ICT में कर लें, तो उसके सॉफ्टवेयर के लिए भी मैं कोलैबोरेशन में हूँ कि if I can get that. Because we are public sector, the paucity of funds and all that. Either you win a grant, get a philanthropy, otherwise it's. And another thing we've analyzed and I've submitted in the ECR, but I'll just share with you just a preliminary. The Gale model for risk assessment. देखिए आपने risk assessment भी करनी होती है. They're models, they're calculators, and that we are doing since December 2021. हमने वो किया, and अभी एक preliminary है, but our risk assessment, a lifetime risk assessment, is like double of the US, for example. And they're one of the highest. This is but an analysis of a year's thing. Let's see. आगे जो है, they're going to, until I have 2 or 3 years under my belt, तो फिर मैं अगर actually बोलूँगी. So एक entire PhD हुई, which was health system strengthening of Islamabad, using breast cancer screening as an interventional approach. And then multiple after that. The papers are there, but आपके undergrad, postgrad, MPhil, PhD. So we are open to all of you as well to come in for research. A lot of universities are sending. So it's not only कि मैं अपने fellows कर रही हूँ train, but you people are most welcome. So there is one मतलब Islamic, Alama Iqbal, etc. PIDE Azam se bhi, there's one girl who's just come in. So please do that. And I'd just like to conclude that it is the first and only state-of-art dedicated breast cancer screening center in the public sector, and we give totally free of cost services to women from all socioeconomic strata. And this is what, just a repetition of what I said, that 50,000 women we've reached out to with all of these statistics. And we hope that in collaboration with you, we become a policy lead for breast cancer awareness and early detection in Pakistan. And the answer to our things is that we need to make it a role model for other such similar centers in different districts of Pakistan. So we finish this at a grassroots level. और मैं आपको बताऊं कि हर district में इसकी जरूरत है. इतना people cannot be getting AJ cases, Gilgit Baltistan se, girls, women coming in. Why can't they have this? Believe me that iski cost thi, I'll just tell you, it was 225 million and 30 million उसमें saving भी हुई at that time. Okay, inflation भी अब अगर आप कर लें तो वही cost आ जाएगी, or maybe a little more. And the running cost is not that much. You set it up next to wherever nearby a tertiary care is. It can just run. You have a referral mechanism also. तो ये क्यों नहीं किया जाता? Facilities भी तो देनी है ना. I'm sorry to say, I mean, this is 10 years down the line, a decade, and no other public sector places come up, though there's so much advocacy for awareness. And I think I look forward to more collaboration from all of you. And this is just references and that. Thank you so much. Thank you. So, देखिए, जो जैसे करें symptoms आपके, the symptoms include एक lump in the breast, lump in the axilla, आपका ब्लड हो, निपल डिस्चार्ज, प्यूडी ऑरेंज यानी कि माल्टे के छिलके की तरह हो, और डिम्पलिंग और वो हो जाए, these things. तो अगर ये हो, and especially also if you've got a high family history, ho ya na ho is not there, but for those people who are, they should just, you just need to go and see it. इधर क्योंकि जीपी और वो फैसिलिटीज में वो लेवल ऑफ एक्सपर्टीज इतना नहीं है जो कि होना चाहिए. So you should just come and see. You can come to us, you can go to your surgeon, you have a family doctor, usually होता ही है. लेकिन जी फौरन दिखाएं और बिल्कुल इग्नोर ना करें. मैंने तो 20 साल वाली बच्ची भी देखी है with this thing. और वो समझते रहे अच्छा ये फॉर द यंग गर्ल्स इधर ये है कि जो फाइब्रोएडिनोमास वाली कॉन्सेप्ट है कि जी ये तो अगर आप 26 या 30 से नीचे हैं तो ये तो फाइब्रोएडिनोमा ही है. बट नो, इट हैज टू बी असेस्ड बाय अल्ट्रासाउंड. यू सी कि मार्जिन्स कैसे हैं, लॉबुलेशंस है कि नहीं. अगर वो जरा भी बायरेट 3 है, हमारा एक लेक्सिकॉन है जिसमें 3 इज मोस्ट प्रोबेबली बिनाइन बट स्टिल चांस. सो वी वेट. फर्स्ट टाइम वी कॉल देम बैक, ओके कम 3 months अगेन अल्ट्रासाउंड. But अगर नहीं है, have an FNAC done. And if anybody is removing any lump, please you need to get a biopsy. I'm talking about. आप 20 साल के हो या 50 के हो या whatever, it is irrelevant. Now age is not relevant. Okay, you see it more commonly in the 30, 40 years age, but my own colleague doctor, you know, which was younger, oh, fibroadenoma, take it out and analyze it, it's got a major ductal carcinoma. And then you see that thing in another surgery, another thing. तो मुझे ये है कि बस जैसे ही हो कौन सा आए. ठीक है, रिस्क फैक्टर्स की मैं बात कर देती हूँ. रिस्क फैक्टर्स में ये है कि ठीक है, एवरीबडी सेज लाइफस्टाइल, ओबेसिटी, स्ट्रेस, पोस्ट मैरिजेस एटसेट्रा. बट आई थिंक कि हमारे यहाँ द एनवायरनमेंट is the biggest player. An environment play, I think it's this lack of control on the food things, this adulteration. All of these injections, milk for production, okay, oxytocin, the chickens, other thing, that thing, and the high level of radiations now, we're seeing the pollution and all that. Just look at the smog levels and all that. So our next thing was a climate expert I'd called, and she was very good. We compare, for example, smog level. I think Lahore is the highest. Agar aap wahan wo dekh le, you know, have a thing between that and the thing. But for the hilly areas, मैंने देखा मुझे लगता है ionizing radiation है और soil का भी है. क्योंकि मैं ना, I'm worried about the Kashmir bit as well. And I see younger and younger patients coming. जैसे हमने अफगानिस्तान में जो यंग मेल्स आते थे ना, अभी भी है लिम्फोमा के, and all that duration of war, and I don't know what sort of things were, what sort of ammunition or what sort of things were used there, but lymphoma, so the lymphoid system. So these are realities. And then ये unchecked गया तो हमारा तो 1:7 आ रहा है, यहाँ तो 1:8. I quote what is like pub वैसे, but जो अभी 10 year का amalgamate करके हम करेंगे, so ours is a rough calculation which we did was 1:7. And the Gale model जो हमने use किया, the lifetime risk होता है 90 years तक. So if you live up to a 90, so ours is coming to around 20%. It's 12% of the years. आप ये देखिए, and really, even my own mother's best friend and all that, at 89. मतलब I couldn't believe it, and it was gruesome. I did a biopsy also, Zahir hai biopsy, and I just couldn't believe it. I said at 89, the ladies got this. So इसलिए 20 हो या 90 हो. So don't waste time. And all of you, please come in for your mammographies. Younger ones, come in, have your, at least अपना once a year ultrasound करवा ले. Younger वाली girls, I mean, it's radiation free? There's nothing in it. Or even ये misconception है कि mammography में वो है. It's like a chest X-ray, okay? It's not one chest X-ray. It's 2 chest X-rays, but it's worth it. वरना this stage 1, even the 2. जो I say कि self examination करें, but आपको नहीं पता चलता. वो जब 3-4 ही है जो पता चलता है. Really. 2 भी कोई बहुत ही expert हो या कोई इस तरह हो कि वो कर सके. 1 तो
1 साल पहले
जी
इसी तरह हुआ था, तो डायग्नोज हुआ था. और शायद मैं थोड़ा ब्लंट हूँ यहाँ, लेकिन चूंकि हम इस्लामाबाद में थे, तो इस्लामाबाद में जो सबसे बड़े हॉस्पिटल कैंसर के हवाले से होते हैं, ایک نوری ہمیں نظر آیا, اس کے علاوہ ہمیں شفا انٹرنیشنل نظر آیا. تو میں پہلے تو گوگل پہ میں نے چیک کیا کہ کون سے بہترین ڈاکٹر ہمارے اسلام آباد پہ ہیں, تو وہاں مجھے علی میڈیکل میں ایک ڈاکٹر نظر آئی, ان سے پھر سب سے پہلے ہم نے ڈسکس کیا. تو پہلے ان کی بایوپسی ہوئی, میموگرافی ہوئی, اس کے علاوہ پھر اور بھی فردر جو پروسیجر ہوتے ہیں. اس کے بعد انہوں نے سی ٹی اسکین کروایا. تو پھر ان کو جب نوری میں لے گئے تو وہاں ہیڈ آف ڈپارٹمنٹ نوری کی جو تھی, وہ ویسے کسی اپوائنٹمنٹ دیتی بھی نہیں, لیکن میں نے کسی ریفرنس سے ان سے کروا لی, بالکل ایسے ہی ہے. تو جب انہوں نے سی ٹی اسکین رپورٹ دیکھی تو انہوں نے کہہ دیا کہ یہ لیور کینسر ہے اور آپ اسٹیج 4 پہ ہیں. اسٹیج 4 اوبیسلی ڈیڈ بالکل. تو ہم تو بڑا ڈر کے کہ یہ کیا, انہوں نے اسٹیج 4 بنا دی, ڈائریکٹ لیور میں پھیلا دیا. تو پھر مجھے یقین نہیں آیا, میں نے کہا آپ آر یو شیور کہ یہ اسٹیج 4 ہے, لیور پہ پھیل کے؟ کہتی ہیں ہاں, یہ جو ڈپازٹ نظر آ رہے ہیں یہ اسٹیج 4 لیور پہ اسپریڈ ہو گیا. تو مجھے یقین آیا, میں پھر شفا چلا گیا. شفا میں وہاں ڈاکٹر تھیں, انہوں نے کہا کہ آپ ایسا کریں ایم آر آئی کروا لیں, اس کے بعد آپ کو کلیئر پکچر نظر آئے گی. تو ہم بھائیوں نے ڈسکس کیا کہ کیا ہمیں شفا پہ کرنا چاہیے, کیونکہ شفا کے بھی کچھ ریویوز ہمیں اچھے نہیں تھے, اور وہ پہ کہتے ہیں بون اسکین بھی کروائیں, یہ بھی کروائیں, وہ بھی کروائیں. ان شارٹ وہ جسٹ ڈفرینٹ ٹیسٹ کروا کے پیسے جتنے بھی ہو سکتے ہیں. تو ہم نے کہا کہ ان کو لے جاتے ہیں لاہور, لے جاتے ہیں شوکت خانم لے جاتے ہیں. شوکت خانم آپ کو پتہ ہے کہ وہ اسٹیج 4 پہ لیتے ہی نہیں ہیں. تو انہوں نے کہا کہ ہم آپ کے جو ہے اس کی ریویو کریں گے, جو رپورٹ ہے اسکیننگ, کیونکہ ان کی اپنی ویسی ہوتی ہیں جو اور کسی کی رپورٹ لیتے بھی نہیں ہیں. تو انہوں نے پھر اس کی ریویو رپورٹ کی. تو فارچونیٹلی وہ جو جن کو لیور کینسر بتا رہے تھے وہ بیسیکلی فیٹ ڈپازٹ سے, جن کو نوری والوں نے لیور 4 پہ لیور کینسر بتا دیا تھا اسٹیج 4 پہ. تو خیر وہ تو پھر شوکت خانم والوں نے ایڈمٹ کر لیا. 2.5 اسٹیج تھی, اور انویسو کارسینوما جو گریڈ 3 تھا, وہ ایگریسو تھا. تو پھر شوکت خانم سے ہم نے علاج کیا الحمدللہ, اور وہاں انہوں نے پہلے سرجری کی, لمپ ریموو کیا. اس کے بعد ان کی کیمو ہوئی, کیمو تقریباً 8 سیشنز ان کے ہو چکے. پھر الحمدللہ ریڈیشن بھی ہوگی, اور اللہ کا شکر ہے ابھی وہ ان کا کینسر جو ہے وہ ختم ہو کے ریموو ہے. اور ابھی ان کو کیونکہ ان کا ہرسیپٹن پازیٹیو تھا, ٹرپل پازیٹیو تھا, تو اس لیے ابھی ان کو میڈیکیشن پہ ہیں, تقریباً 5 سے 10 سال کی ہوتی ہیں, آئی گیس 5 ایئرس کی ہوتی ہے میڈیکیشن جی. تو وہ ان کو مل رہی ہیں. تو میں یہی کہنا چاہوں گا کہ پاکستان میں جو ہمارے اس ٹائم اسپیشلی جو نوری ہو گیا یا اس طرح کے ہاسپٹلز ہو گئے اس پہ, اور اس کے علاوہ نہ صرف میرے دوست ان کی والدہ کو بھی تھا, انہوں نے شفا سے کروایا, اور شفا والوں نے تو انفارچونیٹلی ان کے ساتھ جو کیس کیا وہ تو اس دنیا میں نہیں ہے. ان کی 40 کیموز ہوئی, اور 40 کیموز کے بعد وہ بالکل چلنے کے قابل کچھ بھی نہیں. آپ کو پتہ ہے کہ ایک کیمو ہوتی ہے کتنا ہوتا ہے. تو میں بس یہی کہوں گا کہ اگر آپ کسی بھی ریلیٹیو کو یا خود ہیں تو آپ خود سے ریسرچ لازمی کریں. آپ اگر کوئی ہاسپٹل کو چوز کر رہے ہیں تو آپ اس پہ بہت زیادہ آپ اس پہ دھیان دیں کہ آپ کدھر سے ٹریٹمنٹ کروا رہے ہیں, اور اس چیز کو خود سے آپ دیکھیں, خود سے پڑھیں, خود سے ریسرچ کریں. آپ کر سکتے ہیں. میں نے بھی A to Z میں نے اس چیز کے بارے میں پڑھا کہ کیا ہوتا ہے. میں ساری میڈیکل ٹرمنالوجیز A to Z میں نے اس کو, کیونکہ جب آپ کے عزیز کو ہوتا ہے تو آپ بہت زیادہ کانشیس ہو جاتے ہیں. تو اس حوالے سے میرا تو یہی ہے کہ آپ سب سے بیسٹ جگہ پہ جائیں, اور آپ دیکھیں گے انڈر ون روف آپ کو تمام فیسلٹی مل رہی ہوں. یہ نہ ہو کہ آپ ایک ہاسپٹل جا رہے ہیں, دوسرے سے کروا رہے ہیں. تو آپ اس چیز کے لیے کافی کانشیس ہونا چاہیے, میں یہ سمجھ. تو بس میں یہ شیئر کرنا چاہوں گا. تھینک یو.
بیکاز میں یہی کہنا چاہ رہی ہوں کہ کچھ ایسے ہے, مطلب انفارچونیٹلی جو ٹیچنگ ہاسپٹلز ہیں اور وہ زیادہ تر سارے پبلک سیکٹر کے ہیں. ریمبر جو ایک ٹیچر ہے اور جو ایک اسٹوڈنٹس کے ساتھ, اور وہ ہے that approach will be different. So what we advocate ایک سوچ سمجھ کے اور پرسن کے وہ رکھ کے, and always the empathy is there. لیکن جو پیور پرائیویٹ سیکٹر ہے وہ اس میں نہیں بس. اینڈ آئی تھنک ایون their doctors وہ ان کو کوئی ٹارگیٹس اور وہ دیے جاتے ہیں کہ you have to achieve this patient load, this thing and that. اینڈ یہ ایک ریالٹی ہے. اور لیکن ہمارے یہاں یہ ہے کہ جیسے آپ لوگوں کا بھی ہے, گورنمنٹ میں نہ انکریجمنٹ ملے گی, نہ وہ پبلسٹی ملے گی, نہ وہ آپ 10 سال تک فری کر رہے ہیں. وہ لوگ 10,000 ایک ہے میموگرام اور ورک اپ کا شفا میں, بڑا احسان ہوتا ہے سب پہ, I'm sorry to say, but کہ جی ہاں 50% آف ہو گیا everywhere. Nuri charges. I've taught there for 10 years and I know exactly what you're saying. دیکھیں جس کا جو جاب ہوتی ہے, اگر آپ ریڈیولوجسٹ ہیں, I'm a fellow, I'm a radiologist and I'm a public health expert. वो मैं अपना community वाला work and मेरा अपनी radiology का pure work, उसकी expertise हूँ. लेकिन I cannot कमेंट के कौन सी ड्रग यूज करनी चाहिए या वो, तो उसका कॉन्सेप्ट ही मल्टी डिसिप्लिनरी मीटिंग्स होता है. वो दूसरा जो उसके एक्सपर्ट है. अब मेरे जो काउंटर पार्ट है वहाँ जो ऑन्कोलॉजी के हेड है, अगर उनको किसी चीज पे ओपिनियन होता है या वो सीधी या वो है, वो हमारे पास भेज देते हैं बाहर का हो या हमारा अपना हो के डॉक्टर साहब रिव्यू कर ले. इज दिस, वही आपकी वाली बात, मेटास्टेसिस, ऑल द डिफरेंस पड़ेगा ना. सर्जन भी ये पूछते हैं कि भाई मेटास्टेसिस तो नहीं है, सर्जरी उसी वक्त होती है जब स्प्रेड नहीं होता, लोकली होता है, बट वो नहीं. तो आपकी बात सही है. एवरी फेलो person has to do their own job, and unfortunately in all of these other institutes, I don't want to be critical, but because I've been working also there and I've seen, and ye flaws hai. An oncologist or somebody cannot comment on a CT. We can't comment on their medication regimes and all that. That is their domain. वो है. और I think कि आप फिर वहाँ अच्छा हुआ कि you took, क्योंकि उधर भी domains होती हैं. जो जिसकी domain है वो अपने domain की बात करता है, responsible भी. So हमारे पास we help out all these people because we have MDMs. ठीक है, वो building फर्क है इसके साथ वहाँ, but हमारी 2 breast surgeons है, तीसरी training पे गई हुई है जो कि UK से breast surgery में. So we have those 3 girls, assistant professors who are trained breast surgeons. We've got an extremely excellent person who's head of oncology and a medical oncologist. ये भी देखिए कि रेडियोथेरेपी एक अलग डोमेन है, वो रेडियोथेरेपी के एक्सपर्ट्स और मेडिकल ऑन्कोलॉजी भी. आप लोग तो सब because you're all also fellows and all that, तो आप लोगों को ये रियलाइज होता है. तो बट कॉमन मैन के लिए आई अंडरस्टैंड. आप सोचिए ना.
Professor, I also wanted to add such an experience. My mom had it back in 2000, and she was even less than 40
at that time. And it had nothing to do with any breast lump or anything. She had this pain in her arm, which would sometimes leads towards her chest. And of course, when it didn't go after 3-4 months, 3-4 weeks, she talked to my dad and then they went to the doctor. But of course, there was no heart disease. And then her breast cancer was diagnosed. It was stage 2. And there was no issue in her breast at that particular moment. But definitely inside there must have been a lump which was cancerous. So, she was below 40 and there was no lump. So what other symptoms need to be looked out if people are not going for mammography and anything like that? I mean, this is important.
Yeah. So then that leaves you self-examination. But do remember that in the West, in a lot of countries, because वो इतना scare और वो चीज हो जाती है self-examination से, that people are, constantly, some people get very phobic also. And when the cycle is like that, sometimes the breast is lumpy and then hormonal change is affected. But in our setup, I suppose now, as a developing country, we have to make them more aware. These changes, okay, the lump thing, but they have to then do self-examination once a month. Kar lein. Ye bhi saath pros and cons karke. I mean, that's about the only thing. And those who have a family history have to be very, very careful and vigilant. That they have to, for them, there's no, it can be a false, a positive, false, negative, whatever thing, but they have to just go to the doctor. For them, they have no loopholes. मैं तो यही कहूंगी कि फिर करें, महीने में एक दफा सेल्फ एग्जामिनेशन का जरूर करें, बट उसको जो है ना एज अ एंड बेंचमार्क ना रखें. मैंने ये देखा है ना, उससे बहुत सा ये हो जाता है. इस्लामाबाद में रहते हुए तो भाई, if you've got a setup and there is no cost involved and all that, that's why I'm going to institutes, because 10 years down the line, imagine करें कि because of the lack of what publicity है, the government अपनी चीजें बताती नहीं तो पता ही नहीं किसी को. ये भी है. I'm in the process. Let's see if God willing, we've gotten approval. I got it from last year for establishment of a public sector cancer hospital, which has the surgery all under one roof. Matlab, you don't have to go to the next door building and all that. But for that, it took me 6-7 years, and the amount of resistance, and still resistance. And why for the public sector? And I once said that why so much money of the PSDP is being given to next door, to Noori next door. And even if I go, I have to pay and all that. And I always say, agar taxpayers' money hai, it should be for the poor people. And, it was great difficulty, but then you find help, you find people who believe in it. And we've done that. It's under construction now, and hopefully there'll be a place. People can't afford. Nobody realizes that, and with the current status of inflation, it's you need to make more public sector places. The population is going like from where to where. I'm a big advocacy advocate ना, और मैं advocacy public sector की करती हूँ, और बेहतरीन होता है. और मैं आपको बताऊं कि यहाँ के ही डॉक्टर है ना, शाम को बैठते हैं और वो उधर ही सब जाते हैं and all that. जो टीचर होता है, जिसका years of experience होता है, there is no tools to that.
So I think you,
Yes.
being in public sector and heading one
Yeah.
of the big institution, you should promote that as well.
Yes. So for the public sector, for that advocacy or general advocacy. Yes. So yes. Yeah. So I think we need to go to the information ministry and then convince them that the airtime chahiye hota hai. I mean, for greater good and for public sector. If we can do all the free services, we are, why can't this advocacy for this thing be? It's a very good idea. I think I'll get after them again. लेकिन देखिए, मैं हमेशा कहती हूँ कि सहूलियात भी देनी चाहिए ना. So it's always advocacy, but nobody will say that, okay, there's a facility where you can have this free throughout the year. But yes, because I don't know what it is. I think hegemony and domains and all of this, and the private sector is so proactive in their publicity things and in there because it's money for them. Yeah, so they'll just grab like either mother. You've seen how it is. जी. और इस्लामाबाद में तो बिल्कुल कोई check and balance नहीं है. I think it's really very bad. जी.
Sometimes diabetes with such that we fix them because I have seen just
जी.
they know with the China saying that they are not this working thing.
जी.
Or straight up हम से कांटेक्ट करने का भी पावर थोड़ा सा कर
जी. देखिए, I mean, they do जो good work है, उनका ये वही बात है. They have all that thing. They have people in their domains. They do multidisciplinary things, a proper multidisciplinary. It's with a reasonable cost. I'm presuming, I've never had experience, but जैसे बाकियों का है, test and retest and I don't know what not's happening. There is no check and balance. So, because they have so much of turnover, so I think they don't need to also do, and they have, and they've got a reputation to keep. So they keep that. I've also gone there when I was doing making this thing in the beginning, the center. So that was the place, and I wanted to learn about the one-stop breast clinic, and that's what we've translated here also. So I saw that, and I saw, okay, when there was an MDM, how in their case, their surgeon was very proactive. She was leading, and then the radiologist was there. But jiska jo domain tha, they were talking about that. And then there was a decision there. Here we've developed the MDM thing. We needed this platform here for the MDM. But other places, it's just, I don't know about what, more chemo and radiotherapy, which is so unfortunate. Where is the radiologist? Where's the pathologist? And where is the person who's going to do surgery at the end? So all these institutes have become top heavy because that does bring in its economics. I'm sitting in PIDE, so I think you all can understand. Yes. I mean, how many CT scan ek wo karayenge aur wo hai, what if they, I'll not advocate for another one. Why do that? Agar new adjuvant hai, to new adjuvant hai, then after 2 or 3 cycles, let's assess. We can't have it again and again, and it's not right at all, ethically also. Yeah, and this thing about now have an MRI. This thing about this thing also. MRI, why when you see for metastases and all that, CT chest, abdomen, pelvis, is it? And you just do it once you've seen it.
मुझे सजेस्ट करें कि मैं कहाँ जाऊँ, तो ये है कि इस दुनिया में अच्छे लोग भी बहुत ज़्यादा हैं। और इसी तरह मेरी एक डॉक्टर से उन्होंने मुझे इनबॉक्स किया, कहते हैं कि वो मेडिकल ऑन्कोलॉजिस्ट थी, उन्होंने मुझे बड़ा गाइड किया। वो CMH में रह चुकी हैं, फिर वहाँ से सऊदी अरब गई, और उन्होंने ना सिर्फ मतलब कि मुझे घंटों घंटों मुझे डिटेल से बताती कि अब इस तरह, और फ्री में उन्होंने कोई एक पैनी मुझसे नहीं लिया। और अभी तक वो मेरे साथ मतलब इन टच है। जब भी कोई मसला होता है मैं उनसे पूछता हूँ तो वो मुझे तमाम डिटेल से बताती हैं। और जब मैंने उनसे कहा कि आप मुझे बताएं कि मैं आपकी क्या मतलब इस हवाले से कोई खदमत कुछ ऐसे मैं किसी को रेफर कर सकता हूँ कोई, तो कहती नहीं, आप जस्ट आप ये कर सकते हैं, आप अवेयरनेस फैलाएं, और अगर कोई ऐसा पेशेंट है तो आप उसको मेरा नंबर दे दें सिंपल, मैं आप उनको सब चीज़ें गाइड करूँगी फ्री ऑफ कॉस्ट सब कुछ। तो इस तरह के मैं समझता हूँ कि है, अगर किसी को मसला है तो वो किसी एक्सपर्ट डॉक्टर से जो भी हैं जो अगर ले सकते हैं, ताकि क्योंकि हर कोई अंदर की बातें कोई भी नहीं बताते कौन से हॉस्पिटल में क्या चल रहा है क्या नहीं हो रहा। जिस तरह आपने बताया कि रेडियोलॉजिस्ट अक्सर मेडिकल ऑन्कोलॉजी के डोमेन में आके वो आपको कह रहे होते हैं ये करवा दें। जैसे कि नूरी का मैंने बताया कि उन्होंने मुझे सिंपल मेरी वालदा कहते कि आप तो स्टेज 4 है। इवन मैंने 4 मरतबा उनसे कंफर्म किया, मैंने कहा कि आप क्या श्योर है कि वाकई स्टेज 4? कहती हाँ बिल्कुल ये स्टेज 4 है। तो मैं अब देख लें कि आप उन्होंने किस बेस पे उन्होंने ये कह दिया। तो मैं तो यही रिकमेंड करूँगा कि अगर आप कोई पर्सनली कोई किसी स्पेशलिस्ट से आप अगर इन टच रहें तो वो आपके लिए बहुत बेहतर होगा। खुद भी आप थोड़ी रिसर्च करें, आप देखें कौन सा बेस्ट है। और अगर किसी को भी होता है तो मैं उनको नंबर भी दे सकता हूँ, वो जो डॉक्टर है जिनसे मैंने कंसल्ट किया था, किसी को मसला है तो फ्री ऑफ कॉस्ट आपको सब कुछ गाइड करेंगे, कोई भी अगर इस तरह, क्योंकि हर वक्त अवेलेबल तो नहीं होते।
ये ट्रू है नहीं जी। और देखिए जब लोग आते हैं और अगर हम भी अगर स्टेज फॉर एग्जांपल 5 निकल आया है, बायरेट 5 है, 4 है, बायोप्सी कहते हैं, उससे पहले भी उनको गाइड करते हैं, उनको बता देते हैं कि यू कैन टेल नोड्स में गया हुआ है, यू सी इट एंड इट्स सो। वो बायोप्सी तो ऑफ कोर्स यू हैव टू हैव, इट्स अ प्रोटोकॉल, और टाइप भी पता चल जाती है और सारा कुछ, बट यू टेल देम। और फिर दे नो कि आपका वो दिन है, थर्सडे को द ब्रेस्ट सर्जन विल बी देयर, आप जुमेरात को उधर चले जाएं। और ऑन्कोलॉजी की तो थ्रू आउट वो रहती है, और इस तरह ये फिर दूसरे यूनिट का ट्यूसडे डे है, इस तरह तो आप उनको बता देते हैं, आप उधर लैब बस वो फिर चले जाते हैं। तो देखिए ये तो सदका जारिया है, ये तो हेल्प करना और लोगों को गाइड करना सिर्फ हमारा ये नहीं है कि बस इतना सा काम है और फिर उसके बाद उनको, हमारे लोगों को तो ज्यादा गाइडेंस की जरूरत है। और वो है क्योंकि उनको इतनी वो नहीं है, आपको पता है एजुकेशन एक्सपोजर इतना नहीं है, तो उनको बहुत ज्यादा लोग वो कर लेते हैं, मिसगाइड करते हैं।
कुछ डॉक्टर्स अगर खुद भी करना भी चाहें, लेकिन हॉस्पिटल की पॉलिसी कुछ ऐसी होती है, जैसे कि शिफा के मुताबिक वो तो उनकी पॉलिसी ऐसी कि ये टेस्ट भी करवाएं, वो टेस्ट भी करवाएं। उन्होंने उनके डॉक्टर को बताया था कि आपने इनसे ये सारे टेस्ट करवाने हैं, कुछ इस तरह। तो वो अगर आपको कोई सिंसियर आपको कुछ बोलना भी चाहें तो वो हॉस्पिटल के बाउंड होती हैं कि वो कुछ आपको गाइड नहीं कर पाते। तो ये चीजें भी काफी इसमें आती हैं।
तो आई थिंक रोबस्ट सिस्टम्स बनाने चाहिए, ट्रांसपेरेंट होने चाहिए, रोबस्ट होने चाहिए। और एंड ऑफ द डे जो टीचिंग हॉस्पिटल्स हैं, जो टीचिंग इंस्टीट्यूट्स हैं, और पब्लिक एंड प्राइवेट सेक्टर, लेकिन वो उनको मतलब चेक एंड बैलेंस भी होना चाहिए, आपको इनकरेज भी करना चाहिए। मैं तो फिर से कहूंगी कि भाई पब्लिक सेक्टर को आप करें। पहले like 10 or 20 years before, it was only the public sector ना, so people were getting treated, not misguided and stuff. तो अभी भी अगर आप encourage करेंगे, अगर आप बैलेंस रखेंगे दोनों में, तो फिर बैलेंस रहेगा। अगर आप एक चीज का बहुत ज्यादा एडवोकेसी हो जाएगी और दूसरी चीज बिल्कुल खत्म हो जाएगी, तो फिर तो देन इट्स लाइक क्या है, जैसे कि वो US वाला सिस्टम है, बस फिर हर एक अपना वो करे, इंश्योरेंस ले और पिक एंड चूज करे कि कहाँ वो जितनी ज्यादा इंश्योरेंस दी तो वहां यू गेट। सो वो जो NHS वाला कॉन्सेप्ट है, जो हमारा वेलफेयर वाला कॉन्सेप्ट है, वो आहिस्ता आहिस्ता मुझे लग रहा है कि इट्स आई डोंट नो dwindling, वेरी सैड। So we should all work for that. और आप लोग भी मुझे बताएंगे भी कोई कैंसर रजिस्ट्री की अवेयरनेस, वो उसके लिए सॉरी एस्टैब्लिशमेंट के लिए I'd like to reach out to you people for the caps. प्लीज अगर आप लोग I'd love it अगर आप लोग भी वो we can do 1000 का हमने किया है, we do another thing that way. और अगर आपको कोई मुझे as economists and being in an institute here which deals, if you could give that sort of feedback or put me in touch with collaborators, we can collaborate. I think that's how the world ahead is moving. We can't only also just rely on the government. They make you a setup. پھر خود بھی ہمت کرنی چاہیے. یہ بھی بڑی ایک عجیب بات ہے. بس وہی کریں گے اور وہ کتنا ہی دیں گے. وہ تو ریکارنگ کاسٹ جنرل دیں گے فار نیو انوویشن, نیو تھنگس. تو آپ کو ریچ آؤٹ کرنا ہے. تو لیٹس گو اہیڈ ٹوگیدر. ٹھیک ہے, تھینک یو.